So for the investigations of arterial ulcer, you need now to use the SchrDbb algorithm. You have the disease here, you have an arterial ulcer. Basically, the next one is the cause. The cause generally of the arterial ulcer, we need to know that it's an arterial obliteration. The next one is a complication. The complication of arterial ulcer is that you can have gangrene formation, you can have amputation. Is it clear that those are the complications of arterial ulcer? And we have the different backgrounds of the arterial ulcer, which can be associated with cardiovascular risk factor. The cardiovascular risk factor can be either traditional cardiovascular risk factor, or they can be novel cardiovascular risk factor. The traditional cardiovascular risk factor, it can be divided into two: modifiable and non-modifiable. For the non-modifiable traditional cardiovascular risk factors, we had age that is greater than 65 years, more in males, more in males, and then in postmenopausal patients. Those are the non-modifiable. Now for the modifiable, we have the heart mnemonics, that's hypertension, we have alcohol consumption, we have diabetes, we have dyslipidemia, we have sedentary lifestyle, and we have smoking. So those are the different elements that can tell you in the background, and you have to investigate. Now for the other traditional risk factors, the novel risk factors in the background, we need to know that there is a mnemonics for the normal cardiovascular risk factor, which is called a high UPAC. It's a mnemonic according to SchrDbb. High UPAC. The first H is for HIV. So HIV is a novel cardiovascular risk factor. It can prone to cardiovascular diseases. The second H is hyper, left ventricular hypertrophy. When you have a left ventricular hypertrophy, it can also be another one. The I is a case of any chronic inflammations like vasculitis. When you have chronic vascular inflammations like vasculitis, is going to be the case of I. U is when you have a uremia. Uremia is a novel cardiovascular risk factors for novel cardiovascular risk factors that can result to any cardiovascular disease. P for proteinuria. Proteinuria, a prolonged chronic proteinuria, can say another novel cardiovascular risk factor which can result to cardiovascular disease. A is a prolonged anemia. Chronic anemia can also result to that. And then K is the high UPAC. K is for the kidney failure. Is it clear? If you have a patient has a chronic kidney failure, it can result to cardiovascular risk factors. So those are the novel cardiovascular risk factors that you have to evaluate in your background of a patient that has an arterial ulcer. Is it clear? So in addition to that, we had obesity. Is it clear? Is also another risk factor for arterial ulcer. So you need to evaluate the background. So the background is very important that you have to evaluate. Now the disease is an arterial ulcer. Is it clear? Now when you have an ulcer in front of you, it is arterial. You need to know that there are elements on the physical examination that can help you support that an ulcer is arterial. Are you getting? There are elements on the physical examination that can help you support that an ulcer is arterial. The first element in physical examination is that the ulcer is going to be on the ulcer itself. The ulcer itself, you're going to have punch out edges of the ulcer. When you have punch out edges of the ulcer, it is typical of arterial ulcer. They are very steep. Is it clear? Meaning that they are punch out edges. The ulcer base is going to be pale. Is it clear? It is pale, and when you touch it is very tender and dry. Is it clear? So those are characteristics of arterial ulcer, the ulcer itself. The characteristics you're going to have of the ulcer is that it's going to be pale, it's going to be very tender, it's going to be dry. Is it clear? And then the surrounding tissue are going to be hyperpigmented. Is it clear? That is gangrenous. Is it clear? The surrounding tissue are hyperpigmented, and then the edges is that is going to be punched out. Is it clear? So all those are characteristics of the arterial ulcer and can help you to support your diagnosis of arterial ulcer. Arterial ulcer is a clinical diagnosis. You know that it's an arterial ulcer is a clinical diagnosis. Is it clear? Now the next thing is the other elements which can tell you that it is coming from an artery. Is it clear? What are the other elements mean that which can tell you that it's an arterial obliteration? The other elements can tell you that there's an arterial obliteration is all the other things that you have seen on the physical examination of acute limb ischemia and the clinical presentation of chronic limb ischemia. All the other things that you have seen on the acute limb ischemia and chronic limb ischemia clinical presentation is what you have to use in order to support your arterial ulcer. Is it clear? Now, what are the elements now which can help you now to confirm that there is an arterial obstruction? Is it clear? So there are different things that can help you to confirm that there is an arterial obstruction. So the first thing that can help you is a arterial Doppler ultrasound. I precise arterial Doppler ultrasound because it is there to measure the flow inside the arterial system. Is it clear? You need to know that there's a difference between Doppler ultrasound and the duplex ultrasound. Is it clear? The Doppler ultrasound is there to visualize the functioning, that is the flow rate of the blood vessels. Is there to visualize the flow rate of the blood vessels. That is the Doppler ultrasound. While the duplex ultrasound is mostly there to visualize the anatomy of the blood vessels. So when you want to visualize the anatomy of the blood vessels, you use the duplex ultrasound. When you want to visualize the functioning of the flow rate of the blood vessels, you use the Doppler ultrasound. So it's an arterial Doppler ultrasound, or you can use also the duplex ultrasound. The second one, you can have also an arterography. Is it clear? An arterography, meaning that what? In the arterography, you're just there to visualize for the structural aspect of the artery. You're there to visualize the arterial structure. And to visualize arterial structure here, you inject a radiocontrast material that is going to enter inside the arterial system. And that radiocontrast material, and then later on you do an x-ray of the limbs to visualize the arterial system. That's called an arterography. Is it clear? So you can now do also other elements like CT scan with arterography and then to visualize that. So those are the different things that you have to do in order to assess for an abnormality in the artery. Is it clear? Now, after visualizing the abnormality in the artery, we have the complications. We say that the investigation of the complications that we have here, we have gangrene. Gangrene can be visible on physical examination, except you want to do a biopsy in order to confirm. That's a macroscopic gangrene can be seen on physical examination, where you are going to have friable tissues, you have hyperpigmented tissues, and you have bluish discoloration of the tissues. All that can tell you that it's gangrenous. And then the next thing that's going to tell you that it's gangrenous is that you are going to also have a microscopy that's going to have unnucleated cells, which can tell you that there is necrosis that has occurred. Is it clear? So those are the different elements that you have to visualize in the investigations of arteriopathies and arterial ulcers. Is it clear? Now, after visualizing the investigation, we've said also we have to investigate for the background. You investigate for a patient. So in the background, we have said that there are the novel risk factors and we have the traditional risk factors, which are separated into modifiable and non-modifiable. All that was said at the beginning of this video. Now, the next thing that you have to visualize then is going to be management of arterial ulcers and arterial obliteration.